I'm Dr. David Morris. I'm here to go over with you today the functional metabolic medicine and functional neurological approaches to peripheral neuropathy. I am a board-certified chiropractor. I've been practicing for 18 years. I'm the owner and operator of Magnolia Medical Center in Murfreesboro, Tennessee. And what we're going to cover again is peripheral neuropathy. So if you're watching this, the chances are pretty good that somebody you know or yourself suffers from peripheral neuropathy. So we're going to go over what there is to know about that. So first thing is, what is peripheral neuropathy? And we're going to cover that. We're also going to cover what causes peripheral neuropathy and what can be done about it to restore your peripheral nerves to health. First of all, peripheral neuropathy is very common. It's a chronic disease. In our country, we're very bad at treating and solving chronic diseases. We're very good at acute problems and acute diseases like heart attacks and stroke and accidents and slips and falls. We're very good at treating those things. We're just very poor at chronic illnesses. And one of the things you need to know about peripheral neuropathy is that it's not something that just starts one day, you have it, and you go, oh, now I have peripheral neuropathy. It's something that takes a lot of years and months and years to develop. It's not something that happens right away. It's a chronic issue, and there has many, many causes as to what is, many, many reasons why somebody might have that. So we're going to go over all that. It affects about 20 million Americans. What it actually means is the electrical wires are breaking down in your body. The nerves are actually being destroyed through metabolic processes or problems with activation of the nerves. So we're going to go over that. So it's when the feet or the hands can't communicate to the brain as well. So people have numbness and tingling. They can't feel their feet. They don't know whether something's hot or cold. They don't know where their feet are. They don't know the position of their toes because the brain can actually receive information from their extremities, such as their hands or their feet. And it also is the brain can't communicate because of the destruction of the nerves with the feet or the hands. It is much more common in the feet and in the legs than it is with the hands, but it can also occur in the hands. So if the brain can't communicate with them, that's a motor problem. That's a problem with how you're going to be able to move those joints and those extremities. So what does peripheral neuropathy mean? Well, basically, peripheral means further away from the body. So what we're talking about when it comes to the nervous system is basically the nerves in the extremities, the arms and the hands or the legs and in the feet. Neuro means nerves, and pathy means abnormal or disease of. So basically it's disease of the peripheral nerves of the body. So these are the basic 10 signs that somebody might have peripheral neuropathy. And you're going to see there's a wide range of problems and symptoms that somebody might have here. And that's because there's different types of nerves in the body, which we're going to talk about. But one of the main symptoms is numbness. So somebody can have numbness in their hands or in their feet. They could have burning feet, cramping, sharp electrical pains. They could have pain when they're walking. That's a big one. They can have difficulty sleeping because their legs bother them. Even the sheets touching their feet can be extremely painful. They can have prickling or tingling feelings in their hands or feet, loss of balance or falling. The number one cause of accidental death in this country, even in people that aren't elderly, is slips and falls. So peripheral neuropathy is a big reason why people might have slips or falls. So it's a big problem. They could have weakness or swelling even. It could be a symptom of peripheral neuropathy. The symptoms that somebody might be having, as you can see there were a lot of them, are dependent on which nerves are being affected. So the nerves that carry sensation are called your sensory nerves, and there's different sizes of those nerves that communicate different things. There's the nerves that control muscles. So if you can pick your toe up, point your toe towards the floor, towards the ceiling, those are motor nerves that are controlling that. And we also have nerves that control blood vessels. So how well you get blood flow to your extremities is dependent on these nerves. And if somebody has peripheral neuropathy, they can have huge issues with the blood flow. If somebody had a problem with the blood flow in, say, one foot, they might have that foot that's ice cold, and they might not even know it because they can't feel it. But if somebody had a problem with the blood flow to their legs, then the tissues in their extremities, in their legs, might be actually dying. They might have wounds that can't heal, all because the nerves that carry blood flow, or the nerves that communicate about how to carry blood flow to your legs, are being destroyed from this peripheral neuropathy. So the sensation changes. This is damage to the sensory fibers, and it results in changes in the sensation, burning sensations, nerve pain, or tingling. There's different size nerves. So there's large diameter nerves and small diameter nerves, and they communicate different things. So your symptoms are dependent on which fibers are being affected. So large diameter nerves are pain and temperature, small diameter are vibration and light touch, things like that. So depending on which ones are being affected could determine what symptoms you might be having. So if these neuropathies are left to degenerate, then the symptoms tend to progress towards the body. So the problem gets worse. Somebody has a problem that starts in their hands or their feet all the way down at their fingertips, might sooner or later be all the way up to their forearm or up in their calf. If somebody's motor nerves are being damaged, then we have damage to the motor fibers, muscle control and coordination, weaknesses, loss of muscle bulk. If you've ever seen somebody who had a nerve damage from an accident, you might see, or they had a paralysis, you might see that their muscles in their legs or in their arms are totally flaccid. They don't have any type of muscle tone at all, and they've withered away to nothing because there's nothing activating those nerves. So you can get cramps. These are signs of motor nerve impingement or motor nerve destruction. I'm going to get on a soapbox here a minute about chronic health problems. So we have chronic health conditions, of which peripheral neuropathy is one, and every patient that we see, every single one of them that has peripheral neuropathy has a chronic illnesses that led up to this. This peripheral neuropathy might be the first symptom they're having, but I've never seen one patient that didn't have other chronic problems. And as I said, in our country, we're very poor at handling chronic health issues. We can't just throw medication at a chronic health problem and expect it to go away. We've never seen that happen. How many people do you know that has heart disease, or they've had diabetes, these chronic health issues or thyroid problems, and they get thrown more and more medications and it doesn't fix the problem? In this country, we consume in the United States over 50% of the medication produced on this planet. We consume over 50% of it, yet we have the highest incidence of chronic disease there is. So when we look at problems like peripheral neuropathy, we have to take a multifaceted viewpoint on it. There's not one thing. There's no magic pill. There's no magic therapy that one thing is going to fix that problem, because chronic illnesses just don't develop that way and they don't go away that way. So when we look at these chronic health problems, peripheral neuropathy, thyroid conditions, insulin resistance, diabetes, vertigo, hypertension or high blood pressure, irritable bowel, trouble sleeping, dizzy problems, dizziness issues, migraines and chronic headaches, they all have common threads, and that is they've got metabolic and neurological imbalances that are the root cause of those things. And you have to address both if you're going to have a solution. And unfortunately, our healthcare system is not set up to do that in this country. That's what we do. We look for the metabolic imbalances such as anemia or blood sugar issues or hormonal imbalances or autoimmune issues. And it could be more than one of those things that's contributing to this, to the chronic health condition like peripheral neuropathy. You could have medication side effects that are contributing to that. Hypoxia, which is basically low oxygen. Neurological imbalance, which is decreased firing of the nerves to your brain, or decreased firing of your brain, or decreased firing of the nerves anywhere in your body. It has to be a multifaceted approach if you're going to get long-term results. And if you're watching this, the one thing that I know is you're watching it because you haven't gotten results so far. So you need to watch this whole video in its entirety, all the way to the end, so you can see that there is a solution to the problem that you're having. As I said, all chronic illnesses have a combination of neurologic and metabolic problems requiring proper neurologic treatment and metabolic treatment in order to obtain long-term results. So what do we mean by metabolic? Is taking food, ingesting that food, and turning it into energy in your body. That's what metabolism is. It doesn't have anything to do with calories. It's taking that food and turning it into energy. There's thousands of processes that occur between here and here, and if they don't occur, your body's just not going to work right. If I starved you, if I took away all your food, and you were captive and you couldn't eat, the truth of the matter is you'd find that in a very short time you'd get very weak, you'd be subject to all kinds of illnesses, and that's what chronic health problems are. They're related to metabolic problems. If your body's not healing itself, you're going to have a problem with how you're turning food into energy. No doubt about it. So here's a question. 30% of all your energy goes to what system? Is it your endocrine system, your digestive, your nervous system, your immune, or cardiovascular? Well, the answer is your nervous system. 30% of all the energy that you consume has to go to your nervous system in order for it to work right. Now, that might not mean a lot to you, but if I took my brain and all the nerves out of my body and put them on the table next to me and put them on a scale, it'd make up somewhere between 2 and 5% of my entire body weight. Yet it's using up 30% of all your energy. So if you're not getting any metabolic processes and you have peripheral neuropathy, you need to be looking at a metabolic approach in order to handle it. So you have to have proper metabolism or energy for a well-functioning brain and nerves. It's a must. There's no other way to handle it. Metabolic problems lead to peripheral neuropathy issues. So the leading causes of peripheral neuropathy, and we're going to go through these, but statin drugs, cholesterol-lowering drugs like Lipitor, Crestor, Simvastatin, that is a leading cause of peripheral neuropathy. We're going to talk about that. Damaged back, damaged nerves in your low back. Decades ago, that leads to scar tissue. You get spinal stenosis or bulging discs. That can lead to damaged nerves and lead to peripheral neuropathy. Type 2 diabetes or insulin resistance. Every patient that I've seen that has peripheral neuropathy has a problem with blood sugar to one degree or another. And many times their doctors told them that their lab work is fine, and we find functional ranges, which I'm going to go over, that show that they're not fine. They actually do have issues with blood sugar. Chronic inflammation, a big cause of peripheral neuropathy. If you have inflammation, if you don't get rid of it, you're never going to get rid of peripheral neuropathy. So inflammation from food sensitivities, inflammatory foods, hidden infections and bugs and critters in your gut, whether they're viruses or bacteria that have gone undetected that cause inflammation in the body, can be a big reason why somebody might have peripheral neuropathy and metabolic issues. Poor omega-3 to omega-6 fatty acid ratio. High insulin. Insulin's a big one. Insulin is very, very, very inflammatory. Your brain and your nerves hate insulin. And so if you have high insulin in your body, you're going to move towards peripheral neuropathy, and you're never going to get rid of it unless that's handled. And chemotherapy drugs, pretty self-explanatory, but a very big cause of peripheral neuropathy. So getting back on that soapbox for a moment, statin drugs. All right, statin drugs inhibit the formation of cholesterol. Now, why is that important? You say, my doctor put me on cholesterol-lowering drugs because my cholesterol was high. Well, your body absolutely has to have cholesterol. It needs it. It can't do without it. And the covering around your nerves, the insulators around your nerves, is made up of cholesterol. So if we reduce your body's ability to produce cholesterol, then we have a big, major contributing factor to why somebody might develop peripheral neuropathy. I'm going to go over some statistics about that. But the sheath of the nerve, or that covering around the nerve, is what is made up of cholesterol. Statin drugs also inhibit the formation of the CoQ10 enzyme. The CoQ10 enzyme is needed for your body to produce energy. Okay? It absolutely has to be there. And if we take a statin drug, we're going to inhibit the formation of that enzyme and thereby reducing the amount of energy. And your nervous system requires 30% of the energy that you give your body every day. Your nervous system requires 30% of that. So if we're inhibiting that, how are your nerves ever going to heal? So it's necessary for nerves to function. Statin drugs are the leading cause of peripheral neuropathy. Now, I have a big problem with statin drugs, and because back in 1989, the pharmaceutical industry said, hey, we have these new drugs that are going to reduce, we're going to make heart disease a thing of the past. And that was in 1989. They said in 25 years we'll eradicate heart disease. Well, it's 2014 as of the making of this video. That's 25 years later. And in this country, we have the highest incidence of heart disease in the world. And we consume, as I said, over 50% of the medications produced on this planet. The top 3 of the top 10 selling drugs in this country are statin drugs, 3 of the top 10. So if we're taking all these statin drugs to lower cholesterol to fix heart disease, and we have the highest incidence of heart disease of any other country on the planet, it stands to reason that statin drugs aren't fixing our heart disease. And the problem is they're causing peripheral neuropathy. They're actually also causing hormone problems because you need cholesterol to make all your sex hormones. Your hormones are what drive your metabolic processes. So statin drugs are just a big, big problem. And every country, there's countries like Sweden and Italy, they regularly have cholesterol levels, tested cholesterol levels of over 300, and yet they have markedly less heart disease than we do. Cholesterol never blocked an artery unless there was inflammation first, and we're going to talk about that. So statin drugs increase peripheral neuropathy. This is from the Neurology Journal, May 2002. Statin and cholesterol drugs increase the risk of peripheral neuropathy by 1,600%. 1,600%. That's huge. This is a neurology journal. So, is cholesterol really the enemy? We talked about this briefly already, but why has heart disease gone up dramatically since statin drugs came on the market? It doesn't add up. Why do countries with chronically high cholesterol have lower heart disease? Why do just as many people with low cholesterol die from heart attacks as people with high cholesterol? It's because cholesterol is not the problem. Cholesterol combined with inflammation is the problem. An analogy is like this. A long time ago, decades ago, what they did is they were doing dissection of people that died of heart disease, and they found that they had blockages in their heart, and those blockages were made up of cholesterol. That was one component of those blockages, was cholesterol. But cholesterol doesn't cause a blockage in the heart without inflammation. So the analogy is if you went out into your backyard and you saw a bunch of rats, well, you might go out there trying to kill all the rats all the time. Well, the rats is the cholesterol. But that's not the reason the rats are there in the first place. The reason the rats are there in the first place is because of the garbage in your backyard. If you got rid of the garbage, there would be no reason for the rats to be there. The garbage is the inflammation. Cholesterol does not, it never did, not one time, ever cause a heart problem in the absence of inflammation. You have to handle inflammation first. Cholesterol is not the problem. So a take-home message from this is cholesterol will never clog your arteries unless you're inflamed. You have to reduce inflammation. You need cholesterol for proper nerve and brain function, as well as metabolic processes related to your hormones. So a second leading cause of peripheral neuropathy is damaged nerves from the low back. So if we have stenosis, which means closing down or narrowing of the artery, of the holes where the nerves come out of your spine, that's stenosis. A degenerating and bulging disc putting pressure on those nerves in your low back could also cause pressure on the nerve and cause the nerve to die. So this is a very common reason why somebody might have peripheral neuropathy. So a common trait of damaged low back is if the spine compresses the nerves as they exit. There's 5 sets of nerves that exit out of your low back, and they go down your leg all the way down to your feet. If we have pressure on those nerves, then those nerves can start to die, and you can get diagnosed with peripheral neuropathy as a result. One of the things that we do in our office is we always, no matter who's a patient of ours for a peripheral neuropathy, we're always going to take pictures of the low back to see if there's a problem, x-rays of their low back to see if there's a problem of how, with the way the nerves might be impinged upon by the structures in the low back. We use spinal decompression on our peripheral as a weapon in our arsenal for peripheral neuropathy. Not everybody needs this, but if somebody has a damaged low back and damaged nerves in their low back, spinal decompression is one weapon that we have in order to reduce the pressure on those nerves and help somebody on the road to recovery that has peripheral neuropathy from that. So diabetes and insulin resistance, again, a major cause of peripheral neuropathy. The nerves need lots of energy to survive. Again, 30% of the energy you plug into your body, you put into your body, it goes to your nervous system. Glucose is the nerve's source of energy. You have to have, they only function off of sugar. So it doesn't mean go eat a lot of sugar. That's not what I'm telling you. Please don't do that. I'm just telling you, as you digest food, your body breaks it down and provides the nerves with glucose from the breakdown of the metabolic processes and how they digest food into glucose. And glucose is supposed to get into the nerves to provide the nerves with all that energy that they need. Insulin is a hormone that puts glucose into the cells. Insulin, what it means, it puts it in. So insulin is it's the hormone. It's a hormone that actually opens the door to the cell to allow glucose to go into those cells and provide those nerves with energy, with the fuel that they need for energy. So if you're diabetic or insulin resistant, that means glucose can't get into those nerve cells. If we can't provide those nerve cells with any energy, then they're going to get sick. They're going to die. They're going to have disease processes. They're going to deteriorate. So this is a big factor. This is something that has to be handled. As I said, all the patients that we see that have peripheral neuropathy have, as a component, a glucose issue, one way or another. So chronic inflammation. We need to go back here for a second. Insulin. Your brain and your nerves hate insulin because insulin creates inflammation. So we can't have insulin too high, but we need insulin to get sugar into the cells. So if insulin's too high, then that gets inflamed. When we're talking about inflammation, we're talking about a major cause of peripheral neuropathy. So inflame from Latin means to ignite. So it means we're going to set something on fire. So you can't build a house while it's on fire. If you're trying to get your nerves to function better, yet you have inflammation in your body or the nerves are inflamed, you're never going to be able to do it. You might as well be taking a blowtorch to those nerves because they're not going to heal if they're inflamed. So we've got to find out what's causing inflammation in your body. If you have inflammation in your body, or maybe you don't know whether you have it or not, but we need to know that if we're going to solve the problem related to peripheral neuropathy. You just simply cannot be inflamed and have peripheral neuropathy. Now going back to insulin, well, diabetes can have many, many, many causes. You can have hidden infections that cause insulin to go up. You can have a poor diet for sure that causes insulin to go up. You could have a thyroid problem that's telling your body to function incorrectly, thyroid hormones that are telling your pancreas to function incorrectly, and that could be a reason why somebody has diabetes or insulin resistant. You could be under a tremendous amount of stress, and your adrenal glands, which sit on top of your kidneys, could be working overtime, producing lots of cortisol that is actually driving your insulin levels up. There could be lots of reasons why somebody has diabetic neuropathy or diabetes or insulin resistance, therefore high insulin and inflammation. That's what we do, is we look for those hidden and underlying causes that haven't been looked for before so that we can get to the bottom of why somebody might have this chronic disease. But again, chronic inflammation, that's got to be reduced. So these are some of the common causes of inflammation that contribute to peripheral neuropathy. Food sensitivities and inflammatory foods. Food sensitivities, if you eat something that your body doesn't agree with, you might not even know that it's happening, but if you eat something that your body doesn't agree with and it causes inflammation, that's going to drive this peripheral neuropathy process. It's going to just send it through the roof. I had a patient in just the other day, and she came in, and what she told us was that we had done a test to find out what food that was causing her inflammation, and tomatoes, of all things, came back for her. She found out that she didn't feel bad when she ate tomatoes, like right afterwards. It didn't make her sick to her stomach or anything like that. But it came back, and it showed in the test results that tomatoes was very inflammatory towards her. So she avoided them for about a month, and she came in the other day and said, I had tomatoes for the first time in a month, and she felt awful 2 days later, just like she had the flu. Couldn't believe how bad she felt just from eating tomatoes at one time. Now that her body got feeling so much better, because she was avoiding this food, she reduced that inflammation, she put that food back in, and she was just inflamed all over again. You can have hidden gut infections. By gut, we mean the intestines. So many people, you can have a parasite not know it. You could have hidden viral infections or bacterial overgrowth in your intestines that cause inflammation. It's a big reason why somebody might have inflammation that could lead to peripheral neuropathy. This is a big one, poor omega-3 to omega-6 essential fatty acid ratios. So essential fatty acids, just so you know, essential fatty acids are the fats that we need in our body. We can't get them, our body doesn't produce it on our own. That's why they're called essential. It means we have to get them from outside sources. Omega-3 fatty acids are typically anti-inflammatory, which means they slow down or help stop the inflammatory process. Omega-6 fatty acids tend to speed up or increase that inflammatory process. So the ratio of omega-3s to omega-6s has to be correct if somebody wants to reduce inflammation in their body. And the truth of the matter is the standard American diet, which we call very sad, just the pun for it, is the ratio that we have of omega-6 fats in our diet compared to omega-3s is somewhere to 20 to 1. So we have 20 omega-6 fatty acids compared to 1 omega-3. It should be 1 to 1. No worse than 1 to 2, 1 omega-3 to 2 omega-6s. And our diets just do not allow for that to happen that way. If you're following the standard American diet, if you want to reduce inflammation, you've got to get that ratio back in line. High insulin, we already talked about that. Your nerves can't stand high insulin. It can't be too high, it can't be too low. You've got to have insulin levels that are not promoting inflammation. And another thing that causes inflammation is hormone imbalances. So we find hormone imbalances in a lot of ways, looking at different labs and stuff to determine how somebody's hormones are functioning. But you can imagine if somebody's cholesterol isn't correct, as I said before, if their cholesterol levels aren't correct, or if they're on a statin drug, it's certainly going to throw off these hormones, the balance of those hormones in your body, and therefore cause inflammation. So metabolic causes need to be addressed if you're to win the battle against this. They have to be addressed. So that takes a functional medicine approach. It takes comprehensive blood work. When we do blood work in our office, one of the things the most common things that we hear is, gosh, Dr. Morris or Kathy, our nurse practitioner, they tell us this is the most comprehensive blood work I've ever had. But with that, we're able to determine what problems they've had that nobody else has been able to find. So it takes comprehensive blood work. One of the things that happens is patients come in our office and they say they've been told that everything's fine by the doctor. Or they've tried different therapies, they've tried different modalities, so they come in a little bit jaded sometimes because they haven't had results up to this point. Well, I'm going to go over with you why that is, because it's certainly possible for you to get results. We see it all the time, and you just have to be willing to look and have a little bit of hope. But if you've been told your lab tests are normal, I want to tell you why that might be. It's because lab ranges are inaccurate. So what do I mean by that? Does that mean that your doctor's using the wrong labs? No, he's not. But there are functional ranges and then there are normal ranges. And I'm going to explain that in a minute. But bell curves are used on looking at lab ranges. So if you go to LabCorp or Quest or whatever lab your doctor uses, one of the things you have to know is how those labs determine what is normal and what is abnormal. If you had lab work done in Seattle, Washington, and then you had the same lab work done on the same day in Atlanta, Georgia, you would actually get two different ranges of lab work, because the lab in Seattle, they're using their patient population as to what's normal, whereas the lab in Atlanta is using their patient population to determine what's normal. And the problem is it's graded on a curve. So what that means is if they look at, and this is what they do, is they look at all of the ranges, all the labs that have come in for that particular problem in the last year or 5 years, and they come up with an aggregate and they go, this is the middle. Well, what's the problem with that? The problem with that is who goes and gets their labs checked? The people who go get their labs checked, are they sick or are they healthy? I'd venture to say that probably 70% of the people that go and get their labs checked are going to be unhealthy. So if we're looking at what's normal and we're grading them on a curve, which is how they're figured, is we're looking at them based on a bunch of unhealthy people. So if you want to know what's normal for unhealthy people, well then you need to then just keep on looking at your lab work the same way. But if you want to look at what's healthy, you got to look at those labs differently. So functional lab values are more sensitive and they reveal more problems. So this is why your lab tests are normal, but you still feel sick. In the red over here, this is the low, abnormal low. So if your doctor said, oh, it's low on, say, your thyroid labs, we'll talk about that one in just a second, then that would be in that range. If it was too high, it would be in this range. Well, functional ranges are going to be this very tight range in the middle. So this would be the ideal range. So if we were somewhere here in the yellow, we could have lots of symptoms, lots of problems, but the labs look totally normal. And that's not the best way to look at it. We want to look at these functional ranges. Here's an example of thyroid. So this is traditional high and low, 0.3 to 5.7. So if somebody came back up with 4.2, we would say that that's normal. But on a functional range, we're tightening this range down to say 1.8 to 3.0, and this would be functionally hypothyroid potentially. So that would mean that their thyroid's not functioning as well as it should be. So if you can't feel your feet, then what happens to your brain? So what we're going to look at here is what happens to your nervous system, or what happens to your brain if your nerves are dying in your extremities. All right. So this is a study that was done as Peripheral Neuropathy, a differential diagnosis and management. And what this study basically says, if you cut the nerves, then you change the way your brain functions. So if you cut the nerves, or you destroy the nerves in your body, in your feet, or in your legs, or in your arms, or in your hands, you're actually going to change brain function. So it's very common for us to see patients that have peripheral neuropathy, and they have a lot of cognitive difficulties. They have trouble with balance. They have memory loss or depression. They have trouble sleeping. They have dementia, Alzheimer's, anxiety. So we're talking about cognitive changes happening with their brain as a result of the nerves actually being destroyed in their legs and feet, because your body actually communicates to your brain, and that communication stimulates brain function. It's a process called synaptogenesis or neuroplasticity. So you have to have activation of those nerves. Your nerves have to communicate to your brain in order for your brain to stay fully functional. This is something called a somatotopic map, and what it basically showed is there's a map of every part of your body on your brain. So if some part of your body isn't communicating to your brain, that part of your brain tends to degenerate. It tends to head downhill, and then it tends to get infectious. As a word, it's not truly an infection, but it starts to spread to other areas. So the part that's in your legs and your feet is right in the middle. And the interesting thing is, when you put your hand on a hot stove, you're not actually feeling that on your hand. What I mean by that is, if we cut the nerve to your brain, your hand would still burn, but you'd never feel it. So it's your brain that perceives that information from your body, and it perceives it on the somatotopic map through your brain, and your feet's right in the middle. So what does a neuron need to revive and repair itself? First thing you have to understand is nerves can repair themselves. You can actually get them fixed. Okay, they're like muscles. They require certain things. The more you work them, the more you do for them, the more nutrition, the better you provide for them, the better they're going to do. And they can actually heal, but they need certain things. We've talked about these things so far. They need good glucose. It can't be too high. You can't have a blood sugar way high, real high. That's not going to help you. That's going to create huge diabetic issues, huge insulin level issues, and that's going to be really inflammatory. That's a big problem. You also can't have your blood sugar levels too low. If your blood sugar levels are too low, what type of food, what type of fuel are you actually providing for those nerves? They're never going to heal that way. The other thing it requires is proper oxygen. So those nerves, if you wanted to burn fuel in your car, your fuel would require, your engine would require two things. It would require a fuel, such as gasoline, and it will require oxygen. Well, your body needs the same thing. So a lot of patients that have peripheral neuropathy, one of the things we're looking at is, do they have any problem with how their blood is actually delivering oxygen to the cells? And you can imagine if you have a circulation problem in your feet, you're certainly going to have a problem with an oxygen delivery issue. But you might have a problem with any type of anemias that are contributing to the fact that you can't get oxygen you're breathing in to the cells, to the nerve cells that allow them to have energy. So we have to have proper fuel. That means glucose, that means oxygen. We have to look at all those things if we're going to determine what's causing the peripheral neuropathy. We went over this as well. You can't have any inflammation in your body. If you have inflammation in your body, your nerves are never going to heal. It's just not going to happen. So we've got to handle inflammation. You also have to have good neurotransmitters. And another thing that your nerves need in order for you to get rid of peripheral neuropathy is activation. By activation, we mean they've got to work, okay? And they need tons of this activation. It's like your muscles, like we mentioned just a moment ago. If you want your muscles to grow, we've got to work them. It's the same with your nerves. If we want them to repair, we've got to work them. There's got to be tons of activation in order for that to happen. So we're going to go over with how we do that. So activation. This is Magnolia Medical Center's our clinic here in Murfreesboro, Tennessee. We're the first clinic in Rutherford County that I know of to use the HACOMED horizontal microcurrent therapy. This is one of the best ways, and it's the most state-of-the-art way to help get activation to your nerves. If you didn't exercise your muscles at all, they would wither away. The same thing happens to your nerves. If you're not going to exercise them, you're not going to stimulate them, then the nerves are going to wear out. The HACOMED horizontal microcurrent therapy is the best, most state-of-the-art electrocurrent therapy to help handle peripheral neuropathy, and we have it here. We're the first in Rutherford County to have it. So what does it do? It stimulates the nerve electrically. It blocks pain. It helps improve blood flow to the area. If we get blood flow to the area, then we can get glucose to the area. We can get oxygen to the area. And this microcurrent therapy helps stimulate blood flow to the area. It stimulates the nerves biochemically. What that means is it allows for greater metabolism within the nerves themselves. And if we improve the metabolism of the nerves, we increase the healing of the nerves. If we increase the healing of the nerves, then your symptoms get to go away, and you can actually fix this problem once and for all. And the horizontal the HACOMED actually reduces inflammation on a local level. It's an alternating current. The scientists who discovered this found that if you have an alternating current, we can hit all different types of nerve fibers, so we can heal all the nerves at one time. That's really important because there's no other electromedical device that does what this machine does. It's a secret weapon that we have. And it's something that we're very happy to have because we can help peripheral neuropathy so well with this. So what is the difference between this microcurrent or electromedical device and other ones? Many of you are watching this and you say, I've tried a TENS unit before. My doctor's put me on an interferential current, or you've tried other devices in the past. So what makes this one different? Well, first of all, it's a horizontal microcurrent therapy. It is the most state-of-the-art, and it has bioelectrical and biochemical effects. So when peripheral nerves start to die, they need to be stimulated, and this is the absolute best way to do it, bar none. There's no other unit that does what this does. So what else can be done for your peripheral neuropathy? Well, in our office, from an activation standpoint, we use rebuilder therapy. We actually give people a rebuilder unit to take home so they can use it at home. And we also do it at the office. But it's an electromedical device that also helps stimulate those nerves. We also do vibration with oxygen therapy. Vibration stimulates certain types of nerves, and if we provide you with oxygen at the same time, we're providing a lot of activation and a lot of fuel for those nerves. So we're delivering fuel to those nerves in your feet that allow for healing. So if we do all of these things at one time, we're providing tons of activation for those nerves to really help promote healing. As I said, we give all of our patients a rebuilder for them to use at home. We do this daily. We have people do this daily in our at home so that they can help rebuild those nerves in their feet on the days that they're not doing therapy in our office. We can't do all the therapies that you need to do at home, but this is one that we can actually send you home with. We give you the pair of socks, the conductive socks, and the unit so that you can stimulate those nerves in your feet, or if you have peripheral neuropathy in your hands, so you can further your treatment while you're not here. It's also yours to keep when at the conclusion of the program so that you can use this when you're done. A lot of patients say, well, what am I going to do about this problem once I'm done my program with you, Dr. Morris? Well, this is one of the things that you're going to need to do. You can use this once or twice a week to help continue to activate those nerves in your feet. So the rest of our program, it includes essential fatty acid creams. We use this in the clinic and at home. So essential fatty acids, it strongly reduces localized inflammation. So we use this cream and we put it on the affected extremities so that you can actually reduce inflammation locally, providing your body with those essential fatty acids that are so important for reducing inflammation and to promote healing. We also use other nutraceuticals or supplements, and we give them to you based on your metabolic lab results. So we're not just saying, here's a couple of vitamins. Again, many of you have looked online. You might have spent hours or days even looking at solutions on the internet, on WebMD, looking at solutions and saying, you know, I'm going to try this supplement next. Or they've put you on Lyrica or Neurontin or medications, and you've tried these hoping for a one-shot miracle. It's not that way, but when we get the metabolic test results back, we will know what your body needs because the labs will tell us. So I want to summarize my key points about this, okay? It takes many different things to handle peripheral neuropathy. One thing's not going to do it. I'm sorry to tell you, you have to have fuel, you have to have activation, you have to reduce inflammation, you have to get rid of food sensitivities. It takes a lot to fix this problem. It's a chronic disease, and there's no chronic disease that's fixed without a multifaceted approach. It just doesn't work that way. Look at the statistics on our health in this country, and it proves it right off the bat. It doesn't take me to tell you that. Look at the statistics from the World Health Organization or the National Research Council and Institute of Medicine. They rank the United States absolutely near the bottom when it comes to our ability to handle chronic diseases. Yet, as I said, we take more medications than anybody. So there's not one thing that's going to do it. It's going to take a multifaceted approach. You have to address the underlying metabolic and the neurological problems to have success. You have to address both or it's not going to work. Know that the problem that you have, if you don't start taking action to do something like I'm talking about, it's progressive. It's going to get worse just like every other chronic disease. So if you can't feel your feet now, but maybe it's not painful, sooner or later you're going to find there's pain in your feet. If you right now, you can feel the warm water in your shower. One day you might not be able to feel the warm water in your shower. These are huge issues. It's a progressive problem. You need to take action to do something about it. Our program, I can say this with 100% certainty, our program for peripheral neuropathy is the most comprehensive and state-of-the-art in Rutherford County, bar none. There's nobody else that takes this type of comprehensive approach. It takes a lot of work. It takes a lot of searching. It takes a lot of research to look at somebody's health issues and know that they're a total individual and figure out what's wrong with them in order to fix their chronic problems like peripheral neuropathy. Nobody's doing that in this area. That's what we do in our office. So to summarize, we do that comprehensive blood work. You know, again, our patients are just totally flabbergasted at the amount of labs sometimes that we look at in order to determine their health problems. But the results speak for themselves. When we can find out what's really wrong by looking at those functional lab ranges and looking at the labs that really need to be done to determine what's wrong with them, we can get great results. So we have to look at those functional ranges to identify the underlying causes, the metabolic problems for peripheral neuropathy. You're going to have to be on an anti-inflammatory diet. You just have to be. If you're not willing to eat differently than you are, potentially, then it won't work. It's just not going to work. You cannot eat foods that cause inflammation in the body and expect to get results with your chronic issue like peripheral neuropathy. It won't work. So the peripheral neuropathy healing and nerve activation. Well, I mentioned we take pressure off the nerves through spinal decompression if that's needed. If somebody has a low back problem, any type of degenerative changes in their low back, any type of stenosis or disc issues in your low back, that's got to be handled with the disc decompression therapy. We do the HACM Med horizontal microcurrent therapy. Again, the only people in Rutherford County to have that. We also do the vibration therapy with oxygen. We also have people do exercise with oxygen because exercise helps bring oxygen, helps open up the blood vessels, thereby increasing the body's ability to get oxygen to those really starving nerves, those sick nerves. We use the essential fatty acid cream and the nutraceuticals and supplements as needed based on what your lab work tells us in order to fix the underlying issues. So how bad is your problem? What's the severity of your problem? One of the ways we determine whether or not we can help you is by looking at a standardized test developed by neurologists called a Toronto scoring exam. A normal score is 74. If your nerves are too far gone by score on this test, we might not be able to help. However, most of the patients that come in still have enough life left in those nerves that we can make a difference. So what's next? Well, the next thing to do is you have to make an appointment. So you're going to call our office, set an appointment, so we can see if we can help you. What happens when you come in for an appointment? I want to cover the first 2 visits, okay? Because those 2 visits are extremely important. The first visit is we do a complete neurological evaluation, including the Toronto scoring exam. We want to know how bad your problem is and if we think we can help, so we're not wasting your time and effort. We review any existing labs that you've had recently done, meaning in the last 6 months to a year. If they're older than a year, we can't really use them. So we want you to bring your labs in. We will review them on that visit. If you don't have any labs, it's totally fine. We just want to make sure that whatever you have, you bring in on that visit. We're going to have some forms for you to fill out. All right, we're just like every other doctor's office, and we have lots of forms. A lot of our patients actually say we have more forms than their typical doctor. The reason being is because we're trying to fix chronic health problems, and we need to know about your health, and we need to know as much as we can in order to make as much improvement as possible. A very important point is that we ask your spouse or significant other to come to that visit. For my wife and my life, we make decisions about our health together, and I certainly would want to know if my wife had a problem. I would want to be at those visits to determine what was going on with that doctor, what was going on with her health, so we can make educated decisions. We ask that the spouse or significant other come to that first visit. So then after that visit, we schedule a follow-up for you. All right. On that follow-up, visit number 2, we do a case review if we're going to accept your case. We can't accept everybody, and we certainly don't want to waste your time and effort. So if we're going to accept your case, this is what we do. We're going to overview further diagnostic testing that needs to be done. Any further labs we need to look at, any further diagnostics, we're going to go over that so you know what we need to know in order to make sure you're getting the best results possible. We go over those neurological findings from visit 1. We go over a treatment plan. I went over earlier all the different things that we do in our office, and in many cases patients need all of those things, but not every patient needs every one of them. So we're going to go over the specifics about your condition and what we can do, what you're going to need to do in our office and outside our office in order for you to get great results. We're also going to review financial obligations. I'm going to touch on that in just a moment. That's one of those subjects that everybody's worried about when it comes to healthcare is the cost. So I want to review that with you today. And also, because of the lifestyle, the dietary changes, the time, finances, all those things that may be involved with fixing your problem, I absolutely require that your spouse comes to that visit or your significant other. If your spouse isn't involved in your medical decisions, in your financial decisions, in your lifestyle or dietary decisions, it's fine if they don't come. But most of the time we found that if the spouse doesn't come to that visit, then we don't actually get to move forward, and it just takes so much extra time to start getting you the relief and the results that you're looking for. So what else do you need for that first appointment? Okay, so when you come in, we have to be able to test your legs. We have to be able to test your feet. We have to be able to test your hands if the problem's in your hands. So we ask that you bring shorts or sweatshirts, loose-fitting pants, a loose shirt, something that's going to allow us to pull the sleeves up or pull those pant legs up and get access to your feet, your legs, your hands, and your arms. You have to have all your paperwork filled out. And the reason we want you to have your paperwork filled out is because we're not like the typical doctor's office. We truly don't want you to spend extra time in our office, sitting at the front, when you're more comfortable filling out that paperwork in the comfort of your own home. So come with that paperwork filled out. We'll email it to you, we'll fax it to you, we'll even mail it to you if you need to, but come with that paperwork filled out. And again, not to harp on this point too much, but bring your spouse or significant other to that visit. So my offer, I can't accept every single person that has peripheral neuropathy for a few reasons. Not everybody can help, but then there's other patients who can't afford care. They might not be willing to make the changes in their lives in order to get the results. So we can't accept every single person with peripheral neuropathy, and we also enjoy treating people with other chronic health problems. So we have a very well-rounded practice, but we love treating peripheral neuropathy. The results, frankly, they're actually amazing what our patients tell us. So we very much are passionate about helping with people with peripheral neuropathy. So in those first 2 visits, as you can imagine, you've seen healthcare costs. Those first 2 visits normally cost $450. All right. So if you make an appointment after watching this DVD in its entirety, I do want you to watch the entire thing. I only have a couple more minutes to go over things with you. I'm going to offer those first 2 visits, both of them together, for $75. So you can come in, and for visit number 1 and visit number 2, it would be $75 for those first 2 visits. Just to be clear, that's not $75 each. It's $75 for both of them, okay? So the commitment that you need to have and things that you're going to want to know about insurance and things, I'm going to review that here. We have 3 rules for us to be able to accept your case. Number 1 is you must be willing to make serious life changes. We're not going to improve your health and your life unless you're willing to make the changes. It took a long time, a lot of chronic health issues for most people to get into this situation, and we won't improve it overnight. So changes in your life will be necessary. You have to take accountability for your health. I won't be the doctor that just barks things at you all day and tells you what to do. Your health is your responsibility. I want to help you achieve that health, but it's your body. We expect you to take full responsibility for it. Insurance may only pay a small portion of this care, and in some cases none at all. All right? And this is a touchy point. We're not Medicare and Medicaid providers. So let's go over for a minute what to expect when it comes to healthcare costs, especially when we're talking about chronic health conditions. I did an analysis. I looked online and I tried to figure out what are the costs that people endure when they have problems such as peripheral neuropathy. And in just some quick calculations, what we looked at was that Medicare, Medicaid, and insurance would pay upwards of $200,000 to $300,000 for treatment for situations such as this. It could be wheelchairs that they cover. It could be a wheelchair ramp to your home that they cover. It could be amputations of your toes or lower limbs that are covered. Each toe is about $9,000 as an amputation. They could cover a cane. They could cover the stockings. They could cover just a number of things that they would cover your medications. Let's face it, if you're already on the gabapentin, the Neurontin or Lyrica, they're already covering that. When you've lost your lifestyle, they'll cover the antidepressants and the antipsychotics to help you feel better about the fact that you're not living the life that you want. So when I add it all up, again, $200,000 to $300,000 was covered. And then I looked at it, and this is a very hard pill for me to swallow, and it's a hard pill for a lot of our patients to swallow, and no pun intended there, but it's at the end of the day, that $200,000 to $300,000 spent, even if it was covered by Medicare, Medicaid, or insurance, do you know how much better the patients were at the end of all that money that was spent? No better. The wheelchair didn't get their feet better. The medication didn't get their feet better. The antidepressants didn't get their feet better. The amputations that we've seen in our office where people have lost their toes certainly didn't get them any better. We're looking at actually getting your life back. So you have to ask yourself, what is that worth? It's certainly not $200,000 to $300,000. We're not going to charge you that much. But when you look at what you're going to have to spend out of your pocket, please understand that they're going to cover all those things that don't help. Okay, so we're trying to help do things that do help, and the truth of the matter is I don't have the answer as to why some of the things are not covered. I can just tell you that in many cases, things that actually help are not covered by insurance, Medicare, Medicaid. We're not Medicare or Medicaid providers, so if you have those insurances and that's all you rely on, it doesn't mean you can't come to our office. What it means is we have to work hard with you to help make care affordable. And we will do that. We will bend over backwards to help make care affordable. On this slide here, it says that we have care plans that are affordable, so affordable that 96% of people can afford the care that we deliver in our office. We work very hard at trying to make our care affordable. But don't shoot the messenger. If insurance doesn't cover it, it's not my fault, okay? I didn't set up the system. We want to help you. We want to help you get your life back. You know, a wise person once explained to me the value of a glass of water. And I said, water's practically free. Are you kidding me? What's the value of a glass of water? And they explained to me that if you weren't thirsty, you wouldn't pay anything for a glass of water. But if you were thirsty, you might give $1 or $2 for the glass of water. But if you were out in the middle of the desert for 6 straight days and hadn't had a thing to drink, that glass of water becomes worth every single thing that you have or own. So the water stays the same. It's the value of it that changes. It's not the cost. So we work very hard at making sure that, because we know the value of our care, we work very hard at making it affordable for our patients. So 6 things to think about before deciding to come into our office and make an appointment, okay? On a scale of 1 to 10, how serious is your illness? The truth is, if you don't, on a scale of 1 to 10, how serious is your illness? If your problem to you is only a 3 or a 4 or a 5, the chances are pretty good that you're not going to be willing to make the changes that you need to make in order to get results. So just don't set an appointment unless you're like an 8, 9, or 10 on the scale of how important or how serious this illness is to you. Where do you see yourself in 3 years? We have a lot of patients that come into our office and they wish that they would have done something about it even just a few years ago, because peripheral neuropathy is a chronic progressive disorder unless you do something about it. So if you see yourself in 3 years as being virtually the same, again, you're probably not going to be willing to make changes that you need to make. But if you can look 3 years down the road and you go, I don't want to be in that situation, then that's an important viewpoint to have. You should call and set up an appointment. How's it affected your relationships? How's it affected your ability to enjoy your life? How's it affected work, the things you like to do, working out in the yard, going shopping, shopping for your kids or your grandkids, dancing, even driving? How's it affected your life? And how much more do you want it to affect your life? Or do you want to get those things back? Think of 3 things you could do if you didn't have the problem that you have. On a scale of 1 to 10, similar to this question, how serious are you about eliminating the problem? And due to time constraints, I can only accept those patients that are truly committed to getting better, truly committed to making those changes. As we went over earlier in this DVD, a lot can be involved. It's not always as complex as I might have portrayed it to be for every patient, but for some patients it is. And we want to make sure that if before you come in our office, you're committed to making changes that need to be made. So if you're not truly committed, don't sign up, okay? You don't have to set an appointment. So you heard what I had to say. You know what we do. We get results with the problems that you have with peripheral neuropathy. So turn off the television or watch this again, but when you're done, call our office and set an appointment. Thank you.
To set an appointment, call Magnolia Medical Center today. Don't wait another day to begin getting relief from peripheral neuropathy.